All right, back to more in depth of primitive reflexes. And remember that primitive reflex usually last for the first few months after a child is born, and they integrate into normalized muscle movement. Your suck and swallow reflex is associated with the intake of nourishment. Is a pattern of a downward pressure on the tongue and the response to the rheumatic sucking. The gag reflex is explicited by a touch to the posterior or back half of the tongue or the soft palate. And the response to this is a gagging pattern. And oral motor reflexes associated with eating and swallowing reflexes specific to the muscle action of the mouth and the oral area. The flaccid bite reflex is explicit by pressure on the gums, up and down motion of the jaw accompanied by feeding behavior. Asymmetrical tonic neck reflex, also known as ATNR, is by turning the head to one side of the infant's limbs, the upper elbow and the upper and lower half of the body, they will extend towards the side that the eyes are facing, and the back of the head will flex. Symmetrical tonic neck reflex, also known as STNR, is when the baby in the prone position and the head is flexed or raised, the arms will flex and the legs will extend outward. And the opposite happens when the head is lowered or relaxed, the arms will extend and the legs will flex upward. The rooting reflex is by stroking or stimulating either side of the infant's cheek, they will turn towards the stimulus and try to feed. The Moro reflex is the infant's head. You're going to drop it backwards. You're going to drop it downward, and that's stimulating the vestibular system within the inner ear. And the response of the infant will be to throw their arms outward and extend, and then they will abduct the arms back across their chest. Palmograph reflex is pretty much the response to pressure to the inside of your palm. By placing a finger or stimulus on the infant's palm, the fingers will curl around. The plantar grasp reflex is pretty much kind of like the palmograph reflex, and pressure across the bottom of the feet, right above the menstrual area of your toes. There you go. The infant's toes will grasp. Postural support reaction, also known as primitive stepping, is pretty much if you hold the baby in a vertical suspension and place the feet on the surface, they will flex one leg and extend the other one in an alternating pattern. The placing reflex is present in both hands and the feet. Pretty much you stroke the area as if you stroke the hand or the feet as if against the tabletop. The infant will lift the arm in flexion, then extend the limb outward, has to place it like on a table. The gallant reflex is you place the baby in the prone position over like the palm of your hand, and you stroke with pressure along the either side of the spine, and the trunk's gonna curve or shorten to the stimulated side. So you're gonna stroke the vertebrae on either side of it, and the baby's gonna curve towards that stimulus. The neck righting is when the head is passively turned to one side of the body, the body rotates as if has a hole in the direction of the face. So it's like you're laying in prone and you passively turn, the baby's body is going to turn with it. Flexor withdrawal reflex is laid baby in a supine position on their back and stimulate or rub or prick the sole of the foot. The baby's legs will come upward towards the chest. That's pretty much for primitive reflexes. We're going to go into communication next, but that's going to be a different video.